Assalamu alaikum. Hello, everybody, and thank you for joining us in the launch webinar for the online course about the role of the private health sector in fighting COVID-19 and achieving health for all. My name is Hassan Salah. I'm the primary health care regional advisor and the team lead for the access to health service. As you already know that the private health sector play a very active role in the service provision in most of the countries in our region. As a background about the WHO effort over the last couple of years about the topic for the effective engagement with private health sector, back to the year of the 2018, we published a technical paper and we received member state endorsement for number of resolutions about the private health sector engagement for advancing universal health coverage. Over the year of the 2019 and the 2020, we conducted more than 50 review and assessment under 3 streams. The first stream, it was about in-depth assessment for the private health sector for a number of countries. Second one, about the potential role of the private health sector in the COVID-19. And the third one was dealing with the role of the private health sector in maintaining of the essential health services. Last year, for the 2021 in the RC, and this is the annual meeting for the ministers of health, we had a marketplace event, and it was mainly about the private health sector with several panel discussion and publication. Today, in a joint collaboration with the headquarters and our partner, primary health care partner, we are going to launch the online training about the role of the private health sector in fighting COVID-19 and achieving health for all. The 1 hour agenda, we are going to start with opening remarks from our colleague, Dr. Awad Mataria, the director for the Universal Health System Department in WHO OMRO, and we'll follow with 2 presentations. The first one, it is about the introduction to the country connector. Our colleague, David Clark, from the headquarters for the Department of the Health System Governance and Finance, will deliver this presentation. And the second one, it is about an overview of the course. And it is a joint presentation from David and our colleague, Barbara. She is a private sector engagement consultant, and our colleague, Mark, from the University of Edinburgh. Then we'll follow between 15 and 20 minutes questions and answer, and we'll have the closing remarks later on. Let us start with the opening remarks and the floor for you, Dr. Awad. Please.
Thank you very much, Dr. Salah, and thank you very much our colleagues for joining us. Let me also thank all our partners in this very important initiative. It's very nice to see Barbara smiling on the screen. It has been some time we didn't meet. It's really great to have you as well. I mean, as my colleague Hassan mentioned, this is a very important initiative for us. I mean, even going back more than almost 10 years, exactly 10 years, in 2012, we produced a very important regional committee paper that was endorsed by our ministers of health, in which we had identified 7 priorities for health system work. One of them was about engaging with the private health sector. So going 10 years back, even before discussing anything about COVID, we had realized in the region the importance of engaging, the importance of involving the private health sector in health service provision. And then the goal of universal health coverage became very prominent, very important for policymakers. So we started looking at how the private health sector can be part and parcel of any national strategic health plan, any policy to advance the goal of universal health coverage. So we started to see how to engage. We indeed, at the time, we had a three-pronged approach for working with the private health sector. Our first realization was that we don't know much about what is happening in the private health sector in most of the countries, regardless of the income of the country. So we invested in collecting information, collecting data about what do we define, what would we include under the umbrella of private health sector, and then what information is available on the private health sector involvement in the different countries in the region. The second area of work, the second focus was on the regulation, because we believed that, and we continue to believe that it is very important to regulate the private health sector. We cannot just leave it to the market to do whatever it wants to do, because for me, I'm a health economist by training, so I can understand very much the different market failures that exist in health, and hence we cannot just leave it for supply and demand. We have to regulate the private health sector and its involvement. And the third one was to see how we can partner with the private health sector. So we worked intensively on assessing, on regulating, and on partnering with the private health sector. And as my colleague Hassan mentioned, we managed to compile a lot of evidence, a lot of information from the countries, which we presented to policymakers to engage in policy dialogue with the private health sector. Now, when the COVID hit the world and our region, it became obvious that the public sector alone cannot afford and cannot comply with all the needs. And despite the fact that in many countries, even in our region, the private health sector was sidelined at the beginning. Even hospitals were not involved in any discussion around the around the response to the COVID pandemic, let alone the solo practitioners or the primary healthcare practitioners within the private health sector. But a few months later, it became obvious that we need to engage them. Countries started seeing how the private health sector can be involved. I mean, what we have been trying to do beside the information, beside the sharing technical expertise, is the realization that there is a need to build capacities in how to deal with the private health sector. And that's why we were really privileged and grateful when David mentioned that there's this idea to come up with a capacity development course on how to engage the private health sector in general, to move towards SDG 3, health and well-being, but in particular in addressing the challenges related to COVID. So we very much look forward to the launch of this initiative and to promoting it more and more amongst our member states, to see more policymakers, high-level practitioners, even practitioners in their own clinics and who are dealing with service provision in the countries of our region, getting involved in this training to be more effective in responding to the needs of the people in our region and also globally in that matter. So I'll stop here and looking forward to a great 1 hour together and see how we can move jointly in addressing this agenda. Thank you very much. Back to you.
Thanks a lot. Thank you very much. The floor is yours, Dave, for your presentation about the introduction to the country connector. Over to you, sir.
Thank you so much, Hassan. Thank you. I just wanted to quickly acknowledge right at the start that when I started at WHO in 2015, the first ever meeting I went to was in Cairo to be part of EMRO's excellent work on this topic. So I really want to acknowledge that EMRO has been, since I've been at WHO, the region that's really led on this topic. And I think it's really important to acknowledge that from the start. So welcome everybody. So I'm David Clark. I work at WHO HQ. I'm the acting team leader of the governance unit at HQ. And I'm just going to give you a very brief overview of the work on the private sector we've been doing at HQ in conjunction with EMRO and other regions. Next slide, please. What I'm just going to quickly do is give you an introduction to this initiative called the Country Connect on Private Sector and Health, of which this new course is one component. And then with my colleagues Barbara and Mark, we'll discuss the course, and then we'll have an opportunity for questions and answers. Next slide, please. So next slide, please. So what's the Country Connector? So we're working on the Country Connector because EMRO member states, as Hassan and Awad told you, asked for support in this area. I think it's also important to acknowledge that there are 2 separate World Health Assembly resolutions on this topic, And there are also various declarations on this topic in the African region, all underlining the importance of this area for our member states. When it comes to this particular topic of COVID tools and vaccinations, there are specific normative guidance and documents which highlight the importance of working with the private sector, which are on the right-hand side of this slide. And we'll make these slides available to everybody after this course, so we don't necessarily need to go into them in great detail now. Next slide, please. At headquarters, in 2019, at the behest of our then Executive Director, Peter Salama, we set up an advisory group to help us to work out how we could best work as WHO on this topic area. And we were very lucky to have Dr. Salah as part of that advisory group to provide us with valuable advice from the EMRA region. Next slide, please. And that's advisory group's work culminated in a strategic document, which was based on the idea that a well-governed health system is one in which public and private actors collectively delivering public health goals, whether they be UHC or health security, in the case of the topic we're going to discuss today. So really what we wanted to do with this work is to build consensus around the means and strategies of engaging the private sector, recognizing that member states recognize there was a need to do so, but our work now is to help member states to work out how to do this in practice. Next slide, please. So in light of this, one of the key aspects that was core part of the strategy developed by the advisory group was this slide here, which are 6 governance behaviors. These 6 governance behaviors are elaborated on in the course and are subject of one of the course videos. And they are at the core of our advice to member states on how they can best work with the private sector to achieve their health goals, to combat COVID-19 in the short term, to support efforts towards UHC in the longer term. Next slide, please. Now, in light, and then could you please click through thank you. And in light of this strategy, in light of the need to implement it, what we've been working on the last year is an initiative called the Country Connector in Health. The Country Connector is intended to deliver on countries' strategic priorities, supporting them to strengthen their health systems, to respond to country needs and demands, to support the efforts of multiple health actors at national and regional level and local and international level, through strengthening coordination and accountability, all to improve and deliver better health outcomes. Next slide, please. Primary audience for all of this is countries, and the secondary audience at the global level is all the different agencies that work on this topic with WHO in this important area. Next slide, please. So these are some of the activities from the Country Connector. The Country Connector has its own website, and we'll post in the chat where you can find the website. There are a series of different activities in the Country Connector, one about tools and guidance, one about real-time news about how countries are engaging with the private sector, a portal for for countries to come and get assistance in this topic area, a help desk. We have several working groups which are looking specifically at different aspects of the private sector and health. We've been preparing in-depth briefs on urgent issues affecting countries, particularly in light of the pandemic. And the last but not least is the Open WHO course, which we're going to discuss today. Next slide, please. So that's a very brief overview of the connector. Just pausing now to go on, have a look at this, an introductory video on the Open WHO course. Thanks, Ian.
COVID-19 has exposed the fact that the private sector is undergoverned. To assist countries in long-term efforts toward universal healthcare coverage and in short-term efforts to effectively deploy COVID-19 vaccines, therapeutics, and diagnostics, the World Health Organization is offering a free online course on engaging the private sector to deliver COVID-19 tools and achieve health for all. If you are a policymaker, program manager, or a global health researcher, register now to obtain your World Health Organization and American Association of Continuing Medical Education certification. Explore the tools for engaging the private sector in your country's COVID-19 response. Get connected to a hub of tailored resources on private sector and health. You may complete the training at your own pace on your preferred device in multiple languages. The course will help you understand what is meant by private sector and private sector engagement, map and define private sector actors that are relevant to a particular health problem, recognize the critical challenges, benefits, and risks of private sector engagement, define the range of tools used to engage the private sector in health in alignment with policy goals. Now is the time to collaborate. Let's align for public health. Available from January 2022.
Thank you, Aya. Next slide, please. So in terms of the idea behind this course, as you saw in the video, we're trying to help course participants to do several things. We're really conscious that there are some people who this is a complicated area, so we're very conscious that some people don't necessarily understand all of these aspects. So one of the things that we're really wanting to help people to do is identify the scope and the scale of the private sector in their country so they can work out how best to work with the private sector as part of their health efforts. We want to be able to map and define the private sector actors that are particularly relevant to the delivery of COVID-19 tools, whether that be people who can deliver vaccines or who can provide storage facilities or private sector actors who might have extra health workers to help to administer vaccines. We're trying to help people to understand key concepts related to the private sector and health, and to understand in more detail how to go about working with the private sector, focused on the governance behaviours for effective stewardship of health systems. We try to explain the benefits and risks of working with the private sector. And last but not least, we define a range of tools of government which are intended to shape the scope and activities and behaviours of the private sector. Next slide, please. So I'm just going to pass over to my colleagues Barbara and Mac to discuss in further detail the course modules. Over to Barbara and Mac.
Okay, I'll jump in there, and good day, everyone. So in designing the course, we wanted to try to incorporate coverage of both theoretical and also practical topics, consistent with those learning objectives that David has just outlined. So we felt that the theory is important. We do need to have a clear set of concepts, a clear shared terminology. What do we mean when we talk about the private sector in health? We need a shared understanding of the current situation. How big is the private sector? What does it do? For whom? At what level of quality? At what level of performance? And also a shared understanding of where the key challenges and opportunities lie. So we wanted to provide a good, robust conceptual framework to underpin the course, moving on to some important themes and topics around what are the important behaviours that underpin effective governance of the private sector in health. How can we try to ensure that the sector operates in a way that's consistent with public health goals? And we wanted to look at policy tools, specific ways that governments can intervene in the market to ensure that they're actually able to create the right incentives, the right kinds of accountability mechanisms to safeguard and promote health outcomes. So these are some of the questions that we address in the course, but we also wanted to give learners very practical guidance in some key areas. So the course provides practical guidance on specific tools, such as contracting, a very important method for expanding public health capacity, especially in times of emergency, of course, and also guidance on the kinds of institutions that are needed to establish good, purposeful, and transparent public-private sector relationships through mechanisms like public-private dialogue. So I think that through this combination of conceptual clarity and practical guidance, we're going to be able to provide a clear sense among country policymakers and other learners how they can think differently about the private sector and work across sectoral boundaries in the future, and as a matter of routine, to take the practical steps that are required to strengthen governance of the private health sector and improve health outcomes in the longer term. That's over.
Thank you. Barbara, did you want to add anything to Mac's comments?
No, I think Mark covered it well, and we'll be delighted to address any questions in the Q&A period that are specific to some of the modules. Looking forward to the discussion.
That's great. Thanks both. Next slide, please. So who should take this course? Well, in our view, there are a number of audiences. We're very much conscious that in this time of COVID-19, that it's not just an issue for the health sector, that many countries have COVID-19 task forces of government agencies working together, hopefully with the private sector, to end the pandemic. So we hope to reach those task forces. We're very much interested in reaching our own workforce, WHO's workforce, Ministry of Health colleagues as well, other policymakers, but also intermediaries who work with policymakers. We're conscious that countries often turn to academia for advice in this area, so we're also targeting those intermediaries as well. Next slide, please. So what's the format of the course? The course is going to be an online course. It's an online course. It's self-paced. It's asynchronous, and it will be mobile and web friendly. We're all set to go with the course. There's just a few things to add to it in terms of some extra language options. We're hoping to have all the WHO languages represented on the course. Next slide, please. In terms of its structure, each module is intended to take around 2 hours. There's a 15-minute video followed by a document which describes in further detail the content in the video, and then there's a short quiz, all of which will contribute to course participants obtaining a certification that was mentioned at the start. Next slide, please. In terms of the languages, I mentioned that we're going to have it in, I think, almost all the WHO languages with the exception of Chinese. We're ready now with English, Arabic, Farsi, and French. And we have translators working at the moment on Russian and Portuguese, and that will happen within a couple of weeks. It's going to happen very quickly. Next slide, please. And in terms of how this fits into WHO's broader thinking about building capacity in this topic area, this is just phase one of our work. So we thought it was very important to start during the pandemic because, as Mark said, the private sector plays such an important role in the health system, and in particularly in the context of this emergency situation. We thought it was important to get a course out there for people. The second phase of our thinking is that we'll prepare a much more detailed foundational course, which will provide much more detail to policymakers and to others about this topic area. And then the third phase, we'd like to go into more detail again with hopefully more in-person and tailored courses, which would be addressed to country needs and demands. Next slide, please. So that's the end of the presentation. So we're looking forward to participating with you all in the course and opening the floor for questions and answers. Thank you for your attention.
He's on.
All right.
You will.
All right, I will repeat it again. There is several questions actually on Slido, and the first one is from Dr. Walid Kamal. Over to you, Dr. Walid. Please introduce your name and your official title, please.
Thank you so much, admin. Thank you for this highly appreciated module, and I believe it is a unique one for the MENA region. I am Walid Kamal. I work as UNAIDS country manager in Egypt. I would like just to ask to what extent are this module can be applied in beyond the COVID situation?
Thank you, Dr. Reid. Mark, can you kindly respond to this question, please? Over to you.
Yeah, for sure. And in fact, this was one of the questions we were asking ourselves as we set about designing the course. So how can we make sure that the tools and concepts that we're talking about on the course are going to be relevant to COVID, but also beyond COVID? And essentially, the course is really about, what does it take to develop an appropriate apparatus for effective governance of the private health sector? And a strong governance regime is extremely important in times of emergency, when there's a surge in demand for specific health goods and services, and there are risks to the continued supply of essential health goods and services more generally, all of which requires optimization of health system capacity. But the apparatus we're examining in this course is, I think, just as relevant to health challenges outside of that emergency context, and really is very relevant to the long-term task of building health systems over time so that they can become stronger, that they can deliver higher quality services more equitably, and indeed can achieve universal health coverage. So this is about how governments and their partners can establish effective governance across the whole health system, public and private. And so, yes, the immediate focus is COVID. This is a set of learning content and a curriculum that's going to be relevant to pretty much any health system objective which you're prioritizing. So in most countries, especially EMRO countries, but also around the world, we know that the market in health goods and services is big. It's too big to fail, as the saying goes. And so this is a course in which we're trying to set out a way of thinking about how we can avoid market failures, how we can harness the private sector for routine health policy objectives, as well as those that we're facing right now in the context of COVID-19. Thank you.
Thanks a lot, Mark. The second question, it is from Dr. El Sheikh Badr, Chairperson, Community Medicine Council and Arab Board of Health Specialization. And I guess, David, you can respond to this question. The question is, what do you mean by the private sector engagement? Over to you, Dave.
Thank you very much, Hassan. So private sector engagement for us, sometimes people get a little bit confused by this term and they think it relates to dialogue only. But for us, it covers a wide range of different activities, including understanding what the private sector is doing in a particular country. It also covers things like regulation. It includes the governments making policy about the role of the private sector in their health system. So it encompasses a wider range of activities than just dialogue. And this is where the concept of the governance behaviors, which are outlined in the course, comes in. So really, it's about the performance of these 6 governance behaviors, all of which contribute to governments performing their stewardship role. That is their role to make sure that all the health actors, whether they be public or private, are working together for agreed national health outcomes. Thanks.
Thanks a lot, Dave. The third question is from Dr. Nagwa Higazi. Can we unmute Dr. Nagwa, please, Ahmed? Over to you, Dr. Nagwa. Please introduce yourself and your title, please. Hear us? Yeah.
Yes, I can hear you. Do you hear me now?
Yes, please introduce yourself and go on to your question.
Thank you so much for this amazing launching and for this great webinar and for this nice module. I am Nagwa Najat Higazi, Assistant Professor of Family Medicine, Faculty of Medicine, Nufia University. I'm also WONCA EMR Honorary General Secretary. My question would be, the private sector is extremely diverse. How do you define the private sector in this course? Also, can you please advise on when will this course be available in other languages? Thank you so much.
Thanks a lot, Dr. Nagwa. I guess you can answer. Okay, over to you, please.
Thank you so much, Dr. Nagwa, for your question. So for the sake of this course, we define the private sector as all entities that are neither owned nor controlled by the government, Those involve for-profit, not-for-profit, formal, informal, as well as domestic and international entities. So that's for the first question. And for the second question, as Dave mentioned, I mean, the maximum will be by mid-February, where we have Arabic, Farsi, and French, but we expect it to be available way sooner, and we will communicate the launch date of the exact languages once they become available to all the attendees of this webinar, and all those who have registered as well. So we will keep you in touch. We'll keep updating you.
Thanks a lot, Aya. Thank you very much. Really appreciate it. Okay, the next question is from Dr. Zinia Sultan. Can we unmute Dr. Zinia, please? Thank you, sir. Dr. Zinia, can you hear us?
I can hear you, Dr. Hassan and colleagues. Do you hear me?
Yes, over to you.
Thank you. Good afternoon to you all. I'm Zinia Sultan, the Public Health Officer for UNHCR in Egypt. I have a question for the panel, is that how can governments ensure adhering to policy and regulations by private sectors working for health service delivery? If you allow me, can I have a supplementary question as well, Dr. Hassan?
Shall we respond for this first, and then you will follow with your... go on, please, and complete the whole question. Yes, go on. Yes, Zinia.
Thank you, Doctor. It is in relation to the
Really.
presentation, and this is just out of interest on the group of the participants for the course, where it is mentioned as policy makers. So if you could elaborate a little bit, giving the example of the policy makers who would be able to benefit from the course. Thank you. Over to you.
Thank you very much, Dr. Awad. If you can kindly respond to this. This is a complicated question.
Yeah, no, thank you very much, Zinia. Yeah, for the great question. Maybe I can take the first part of it, and then maybe Dave can elaborate on the details of the course itself. Your first question was about how governments can ensure the effective engagement of the private health sector. I think the government has between its hands many tools, many instruments to ensure that effective engagement happens in reality. I guess one of the things that we have been falling into its cracks behind in the back previously is that we were separating between what government does and what the private health sector does. And the idea of the engagement is to look at the system in its totality. So to see the private sector as part and parcel of any national health system development agenda. For that matter, the government should maintain that political commitment, should ensure and express it and translate it into effective policies and strategies on the ground, that we want to have the private sector to be part and parcel of the national health system. And for that to happen, the private health sector has to be considered in the discussion, in the negotiation, and defining national targets, strategies, and move towards also be involved in the development of these national strategic health plans at country level. It is, in a way, for me, it is changing the perspective. It's a paradigm shift. Instead of seeing the private sector as just a recipient of national policies, it should become part of it. But also, to be able to engage the private health sector, it is important to know who is the private health sector. So thanks to that question that was asked before, and who is part of that private health sector. So the information that I mentioned, which I referred to in the opening, in my opening remarks to this. Also, governments can also ensure that there are the proper and relevant legislations in place to be able to get the private health sector involved and engaged. And maybe a last point, as of course it's not exhaustive, but a last idea for consideration is that the governments also in some countries have been effective in providing financial incentives for the private health sector to flourish and to play its role as part of the national health system. So we have many mechanisms like public-private partner under the public-private partnership umbrella, like build, operate, and transfer, build, operate, own, and transfer, and so on and so forth. So all of these are instruments, are levers between the hands of the government to allow for that effective engagement to happen. So maybe in a nutshell, it is to start to be the government of the whole system and not only the government of the public sector or for the ministry of the health system and not the ministry of the Ministry of Health, sort of speaking. So again, thank you very much, and I'm sure if Dave can touch upon the details of the course as it was asked about. Thank you.
Thanks a lot. Over to you, Dave.
I was going to say, I'd just like to thank Awad for making that really important intervention, because that really helps me with my answer. So the course is going to be in the open WHO platform, which is open to everybody. Yes, as WHO, we are focused on policymakers and our own workforce, but we're very conscious, as in light of Awad's excellent intervention, that really this is a combined effort. It isn't just about ministries of health. It's about thinking about how we can integrate the private sector into the national health system. So we would hope that the private sector would also look at the course. And we're already thinking about whether or not we need specific modules to help the private sector to better understand how they can work with governments. Because at the moment, it's very much focused on governments working with the private sector, not the private sector working with governments. So we need to think about how we can do that. Thank you.
Thank you, colleagues. The next question is from Dr. Mohammed Afifi, is a reproductive health and humanitarian program specialist in UNPA. I believe I can answer this. It's a long one. Anyway, he said that the relationship with the private sector is highly context specific. How is the course useful to policymakers from all countries, and any plans for more tailored elective modules? Over to you, Anne.
Thank you, Dr. Hassan. So yes, the short answer is yes. So this is, as Dave pointed out in his last slide, this is the first of many upcoming courses. And so this, the objective of this course is to serve as principles and concepts, but then it will be followed by a more in-depth course, and that's more foundational, which will be longer and also online. And then we will have workshops and more tailored and country-specific courses that will be blended. So it will involve face-to-face and online modules. So yes, that's the short answer. We will have in the upcoming modules something that's more context-specific and tailored to the needs of countries. Thank you.
Thank you very much, Dr. A. Okay, the next question is from Dr. Serhari. Dr. Serhari, can we unmute him, please, Ahmed? Dr. Serhari, over to you, sir.
Hi, good afternoon. I am Dr. Srihari. I'm health specialist here in the UNICEF regional office. And I look primary health care and immunization program. So my question, as it has been mentioned in the audience of the course. So private health sector engagement, and what is the role of corporate social responsibility, especially every private organization, they have certain percentage of resources to be spent on social responsibility. So how you are factoring that in this particular course?
Thank you, sir. Thank you very much. Barbara, if you can kindly respond to this. Thank you.
Thank you for the question. Yes. Okay. Can you hear me now?
Yes.
Yes. Okay. Thank you for the question. Corporate social responsibility is one of the ways in which the private sector can contribute resources, both financial and other in-kind resources, to the overall health sector. And so when governments are looking to engage the private sector, one of the things we talk about is given the health problem and who the respective potential private partners should be, the third question is also, what is the mechanism by which to engage them? And corporate social responsibility is one of the many different mechanisms by which to work and collaborate with the private sector. Having said that, though, we find that corporate social responsibility is important, but not as influential as other possible ways in which to harness and leverage the private health sector. So I did want to add one more thing, though, about and just build on some of the comments that folks were making about the target audience for this workshop. I wanted to underscore the concept that Mark had made about the fact that although this course is focused on policymakers and on addressing COVID-19 and how we can harness and leverage the private sector so the two can work together, we designed the course purposely to based on universal concepts and themes and tools that can be applied to a whole host of other public health issues. And as David said, you know, the eventual goal is to strengthen the overall health system and stewardship. And in this, there's the fundamental concept that there are two partners, public and private. And I really liked what Awad said about the fact that we're changing the dynamics from just the private sector being recipients of policy, but instead equal partners. And so eventually we're thinking that in order for the private sector to become full and effective partners, we also have to possibly develop modules that are directly addressed to the private sector so that we can build their skills and capacity to become effective partners. And so we would welcome ideas and suggestions on some of the thematic areas from the private sector, such as how to get organized and defragment the diversity, better ways to report to governments for data, whatever topics they are that could make the private sector more effective partners. We welcome suggestions from the audience. Over.
Thank you, Barbara. Thank you very much. The next question from Slido, and I believe Dev can answer this. You are our master in FENSA framework. The question is this course about dealing with private sector in accordance with FENSA framework? Over to you, Dev.
Thank you, Hassan. Thanks for that great question. The FENSA framework is a framework that applies between WHO and the private sector. And this course isn't about that. It's about the relationship between governments and the private sector. There are definitely elements that are in the FENSA course, like the question of conflicts of interest, which need to be carefully weighed and managed by governments. But FENSA, the framework, doesn't apply to the interaction between countries and the private sector.
Thank you, Dave. Thank you very much. The next one again on Slido, and I guess our colleague Dr. Awad can respond for this. The question is how to engage the private sector in the absence of national health service package. We just talked about this package in the morning.
Yeah, I mean, thank you. I think this is a very important question, and I think the answer is embedded in the question itself. I mean, it's not only the engagement of the private health sector that is challenging when there is no national benefit package properly defined. I think it's the whole health system and the whole health sector would be challenged for that matter. So even how to ensure that the Minister of Health or the public sector is effectively delivering on its mandate if we don't have a well-designed priority benefit package or a national strategic, an essential package of health services. So I think a starting point for even if we are taking it from the perspective of what we want to achieve, and what we want to achieve is universal health coverage. Of course, nowadays also with the pandemic, we would like to see health security embedded into that. So for me, a starting point is to define a priority benefit package or an essential package of health services. That would be the basis of designing and revamping even the public sector before speaking about the private sector. Now, if this is not happening, then things will remain done in an ad hoc manner. And for the government and for the public sector to be able to engage the private health sector, then maybe we can use mechanisms like strategic purchasing, in which we would define what to be purchased from the private sector, and to define the modality of conducting that strategic purchasing by shaping the provider payment methods for the private sector as well as for the public sector eventually. So I hope that provides some elements of the answer. But my main point is that a starting point, even before thinking engaging of the private health sector, defining that benefit package is important. And maybe colleagues would know that the idea that came out from Lancet Commission on advancing universal health coverage is this idea of progressive universalism, where we would need to start again reiterating the same point by defining those set of entitlements as part of a national benefit package. Thank you very much.
Thanks a lot, really appreciate it. Then the next one, it is actually it came a number of times, this question from the WHO country office from our region, and I guess Dave, you can respond for this again, please. All right, the question is who can join the country connector working groups? This is the first thing. Second, is the country connector a COVID initiative, or it is going to continue to be functional after the pandemic? And the third, again, from the country offices, does the country connector support different languages? Over to you, Dave, please.
Thank you. So the country connector, if you want to join and become part of a working group, please reach out to us. We're very happy. We would love to hear from you. So we have a number of different working groups at the moment, and we are looking for people to participate in working groups, particularly people from countries. This is what this is all about. In terms of the second question, it isn't just intended to be for COVID. Because we're in this pandemic situation right now, we're focused on COVID, but there are many topics that are being dealt with by the country connector at the moment, which go beyond COVID. So, for example, we have a working group which is looking at data in the private sector, how we can improve countries' capacity to govern the private sector by improving the data that they have about the private sector. And that doesn't just relate to COVID. And we are intending for this country connected to be a long-term initiative to support countries to deal with a number of different health issues, not just COVID. I should also just finally add that we also already have on the country connector a working group on maternal and child health, because this is another important area where the private sector is very heavily involved in service provision. So yeah, it's yes, come and join. Yes, it's intended to go beyond COVID. And I'm very sorry. What was the third question, Hassan?
First one is dealing with, does the country connector support different languages? Over to you.
Not at the moment. It's primarily focused on English, but I recognize that there's a big issue about making sure that we can expand it to other languages.
Yeah. Hey, David, and
Excellent.
don't forget the other technical working group. I'm putting a plug for the one that I'm working on, which is the whole issue about collecting data on the private sector and how it can be better used to govern and steward the overall health system. So countries, please submit your name and applications. No.
Thank you, Barbara. Thank you, Dave. And thanks again for our colleagues from the country's office. Thank you very much, participants, for your question and response from the webinar members. Now we're going to move to the closing remarks from Dr. Awad. Please, over to you, sir.
No, thank you very much, Dr. Hassan, and thank you really all colleagues for your time, for the support, for the great collaboration. And I see more and more faces with whom we are really privileged and honored to work with. Maybe one point I would like to bring from our own regional perspective. So our current regional director, when he took office, he developed a vision for his mandate of being in the office for the next 5 years then. And the vision was given a motto, which is health for all by all. And the addition of by all was made on purpose to indicate that we cannot really achieve the health for all ultimate goal that we all work towards without engaging, without working with all. And with all, it should be inclusive, and it is inclusive of private sector, it is inclusive of all non-state actors. It is also inclusive for us as WHO, working with other partners, working with academia, working across UN agencies, and that's why all these activities that we run, we try to run them under the umbrella of the Global Action Plan for SDG 3+, where we are working with all our partner UN agencies for that matter. Maybe my second point is that, again, while we have one of our functions as WHO to invest in capacity building, to share global best practices, but also to build the national capacities to run the health system at country level, we are not an academic institution. So we develop these things in order for them to be taken, to be adapted by national academic institutions, and hopefully to integrate them in the national academic programs. And I'm not sure how many we have from academia on the call, but it is an offer to academic institutions to please do work on these things. We'll be happy to provide that support to see these courses, and this one in particular, being integrated and become part and parcel of the education program. And maybe another point before I conclude, this work is not perfect, and perfect might be the enemy of the good. And it is something that we are learning while we are doing. So your feedback is very, very important for us. So please do reach to us, to Dave, to Barbara, to Mark, to Hassan, or Aya. I mean, please provide us with your feedback so we can keep updating, we can keep enriching this global good, this product that we are coming up with, so that it becomes more and more of relevance and of use by countries. I said this is the last point, but maybe a very last point that I would like to mention. I think one of the things that we always struggle with is the how to. So while we might know what needs to be done, and this is what we try to convey throughout the content of the course, the how to is very, very important. So also, again, it's putting the ball in your camp. Please do tell us and to work with us so that we can document whatever recommendations have been made, the strategic direction have been provided, how they have gone into implementation, and what are the challenges that you might face in doing so, and what would be the enablers to ensure effective implementation. So that's how we can only learn, by moving forward. So again, thank you very much for the entire team for this wonderful webinar, for launching such a great course, and looking forward to your feedback and working with all of you. Thank you very much. Hassan.
Thank you very much. Thanks a lot, colleague. My closing remarks for this, as you may remember, that at the early stage of the pandemic, this is most probably around, say, the second quarter of the 2020, several governments actually from our regions, they announced officially that treating a COVID patient, it is a full responsibility of the public sector. This is actually didn't continue that long, couple of months after that, and to increase the capacity for the service delivery, the private sector actually takes the lead in the test and for the treatment of the COVID-19 patient. And this is actually tell us how the private sector in our region has a major role in the service delivery. The online training for today that we already launched, it is actually provides the policymaker with the tools that they need for the effective engagement with private health sector. My point is that this effective engagement with private health sector has to go beyond COVID-19 and to build on successful models about the engagement. And this is actually our tool to go for the universal health coverage, and in addition, of course, to the health security. Thank you, colleagues, and goodbye.